at the global level, 80% of the population lives in low and middle-income countries. Nearly 95% of the world's children live also in low and middle-income countries. When we look at the picture for the pediatric cancers, each year the world expects 400,000 new pediatric cancer cases. Unfortunately, half of them are not diagnosed and mostly in low and middle-income countries. Of children who develop cancer, approximately 90% occur in low and middle-income countries. One other fact is the survival rates are over 80% in high-income countries, whereas less than 30% in lower middle-income and low-income countries. So this burden and this inadequate survival rates is showing us the burden of the pediatric cancers in low and middle-income countries. To reduce the childhood cancer burden, it is required a concerted effort from the governments, healthcare systems, non-profit organizations, communities, and international agencies. Reducing the burden of the childhood cancer also involves a multifaceted approach that encompasses early detection through awareness program and investment on healthcare workforce, effective treatment through improved access to quality care, and supportive care. These are the main strategies that can contribute to this goal. By implementing these strategies, it is possible to improve the outcomes for children with cancer and significantly reduce the global burden of this devastating disease. As I said earlier, in the last few decades, we have witnessed a significant advancement in the treatment of childhood cancer. Survival rates went up to 80% plus in high-income countries. However, the survival rates are still as low as 10 to 20% in some low and middle-income regions. While scientific breakthroughs have revolutionized childhood cancer treatment, a significant barrier remains the accessibility to cutting-edge diagnostics and contemporary therapies across much of the world. Ecancer has published 4 insightful papers from experts in the field of childhood cancer. These papers encompass various facets of pediatric oncology, ranging from an analysis of the childhood cancer in a middle-income country to the financial dimensions of the pediatric cancer in a low-income country. Another paper highlights the current situation of childhood cancer in the Eastern Mediterranean region. Additionally, the esteemed Organization of the Pediatric Cancers, SIOP, has offered valuable perspectives on the advancement in childhood cancer care, encapsulating their global impact. Let me briefly mention about the articles published in this special issue. One article is summarizing the cost and cost effectiveness of childhood cancer treatment in Haiti, prepared by Bolus and her colleagues. The purpose of this article was to assist in investment prioritization and support national cancer control planning. If I say briefly, the pediatric oncology unit cost approximately $800,000 annually, or $10,000 per patient, which is quite acceptable level. And these findings underscore the cost effectiveness of treating childhood cancer, even in a resource-limited settings, providing valuable data for investors and policymakers engaged in pediatric cancer control strategies. We also try to reflect the situation from a middle-income country, and Soliman and her colleagues from Egypt delivered a narrative review on the state of the childhood cancer care in Egypt. Egypt has a high incidence of the pediatric cancer cases. In a population of 100 million, Egypt sees almost 7,000 cases in a year. as a lower middle income country with scarce resource allocation and the cost effectiveness of the treatments, along with the challenges and factors influencing the care. The survival rates are quite variable in the country level in Egypt. From 45% to 70%. But a good example is the Children Cancer Hospital of Egypt, known as 57357, presents 72% survival rates. I think these investments return to the people of the Egypt, and this is a good example from a lower middle income country. We also wondered how was the situation in WHO Eastern Mediterranean region, and Siddiqui and Belgami reviewed the current state of cancer care and the challenges faced within the Eastern Mediterranean region. This region exhibits a vast diversity in economic development, which is reflected in the heterogeneity of cancer care across different areas. Disparities, ongoing conflicts, humanitarian crises are unique for this region. However, regional and international collaboration offers a beacon of hope. Despite the strides that have been made, there is still considerable work required in the Eastern Mediterranean region. This article comprehensively addresses the various facets of the pediatric cancer care in the region and serves as a valuable resource for decision makers and the stakeholders for the WHO Eastern Mediterranean region. And the final article in this special issue of the ecancer, prepared by the Chalinor and the current SIOP leaders, encapsulates the SIOP's influence over the past half-century as a key international entity in childhood cancer care. With the unique structure that encompasses 128 countries, of which 39 are low and middle-income countries, SIOP's collaborative efforts with partners like Childhood Cancer International, Pediatric Radiation Oncology Society, and International Pediatric Surgical Oncology Society, with its multidisciplinary framework and various programs such as the World SIOP Congress, have significantly bolstered research capacity, targeted disparities around the world, and contributed to the pediatric cancer control through a robust global health network. At the end of the publication of this special issue, I would conclude by saying that the global disparity in pediatric cancer care remains a pressing concern. This is the impetus behind the WHO Global Initiative for Childhood Cancer, which aims to raise the survival rate of the pediatric cancers to 60% by 2030. The research featured in this issue not only highlights the cost effectiveness of pediatric cancer care, but also showcases the potential of regional and international collaboration, offering a golden opportunity for stakeholders and the pediatric oncology community to make substantial progress.